Hi, this is my proposed stroke program for my coordinated care organization. My name is Lacey Millsap. This is for MHA 525, Community Health and Epidemiology, Fall 2015, Pacific University. So just a little bit on the background and need for the program. We are basing our need for our community stroke prevention program on the Framingham Heart Study. This was put on by the National Heart, Lung, and Blood Institute and Boston University. And the objective of the Framingham Heart Study was to identify the common factors of cardiovascular disease, CVD, and it was a large and long study of patients who currently didn't have any cardiovascular disease, had suffered any sort of heart attack or stroke. They were able to gather 3 different generations of data. First one started in the 40s, going into the 1970s, and as of most recent. And the proposal of my program is to decrease the incidence of stroke in our community and how it relates to other illnesses, such as hypertension, dementia, any other diseases that can affect other illnesses. We're also going to have a program about how cardiovascular disease and stroke affects generations in a family. We were able to do this because of the first cohorts, families, and then the succeeding children and grandchildren of the family. In the initial study, we had all their data and information. So who do we need to gear this study towards? Everyone in the community should be aware of risk factors leading to stroke. The population that's highest in need of the program and the highest at risk of the program are individuals aged 55 to 84. In our baseline, it was the free of stroke during the first data, and same thing in the Framingham study. Things that were of noted that can lead to stroke: it's age, blood pressure, diabetes, cigarette smoking, prior cardiovascular disease, AFib, use of hypertensive medications, and left ventricular hypopnea. And why do we need, and what population needs it? We have a large community outreach program to deal with our population and its incident related to stroke. If we have community outreach centers, which I notice down at the bottom, we can have different types of health educators come out and discuss stroke risk factors. Coordination of care through patient care is really important, so you can streamline referrals to specialists. Electronic health records help a lot when trying to get a baseline for high blood pressure, and you can keep very accurate records of blood pressure, and you can also share data with other providers within their care or within our care. The coordination of care also helps with transfers and treatments. So anybody within our CCO will have access to all the data and records of our patients, so we can provide them the best care that is needed. Part of our needs will be improving high blood pressure and ways to decrease strokes and to decrease high blood pressure issues. This will be through either medication, nutrition, relaxation, yoga, meditation, exercise, anything that can help decrease blood pressure to get back down to the normal levels. And like I said, community health centers will play a big factor in our area, just because you can have community outreach people there talking and discussing nutrition and exercise and making sure patients are compliant with their medication that they've been given to control their high blood pressure. Lynn, we think that it's never too late to change your habits, even if you've already had some sort of CVD problems or some sort of maybe minor stroke. You can always start a new program to help lower blood pressure and lower risk of having another stroke. The time is now to deal with your cardiovascular health at any age. So these are the programs detailed that we came up with. We need to increase awareness of stroke prevention and high blood pressure and underlying factors. Discuss the risk factors that cause strokes and related illnesses. Educate the community on preventing stroke starting at a young age. It's never too young to care about your health and aging. It may be a little silly when you're trying to talk to maybe a teenager or even younger, an adolescent child, about being healthy, but I think that every time you discuss it, a little bit sticks with them. We need to have a strong continuing education program for different stages of life. So when I was talking back about like the key demographics in like 55 to 84, is going to be a little bit different than how you talk to somebody maybe in their 20s or 30s, and how education it really needs to differentiate between ages. We will explore how genetics play a role in health. It's been really nice because of the Framingham study. We can see the different generations and how things have changed through the different generations, or how they've increased. We also need a exercise program, like I said earlier, some sort of meditation, yoga, relaxation. Exercise helps reduce blood pressure and stress. A nutrition program on maybe foods that are lower in sodium, anything that can really raise high blood pressure, maybe going to a more plant-based, less processed food eating habits. Then signs and symptoms. When do you need to seek help? Knowing the signs and symptoms of any sort of heart disease, heart attack, stroke, maybe something's just changed a little bit and you are just now noticing, and it could be a leading factor to a stroke. Benefits of our proposed program would be to increase overall health of our population, increase life expectancy and quality of life if you've already suffered a stroke or had some sort of cardiovascular disease problems, maybe a heart attack. What can be done so we can improve your quality of life? And of course, with healthcare and everything, decreasing healthcare costs related to strokes and treatments. With stroke patients, depending on the severity, you may need long-term care, you may need rehabilitation, and all these treatments add up in cost for both the patient, the insurance companies, the facilities, and overall the overall cost of these could be prevented if we started with an early onset education program to help reduce the incidence of a stroke in our community. The cost of the program, it's going to be, we're going to have to restructure a few things. Mostly it's going to be marketing and community outreach programs, so we'll have the cost of both of those. With restructuring jobs and duties, we will probably have to add on more departments with the community outreach, maybe do a little bit more education at time of appointments. And we're definitely going to have to do some upgrades to our electronic systems just to make sure that our CCO is running smoothly and make sure there aren't any flaws, to streamline all referrals or any other information that needs to be communicated through different specialties or facilities or hospitals or rehab and nursing facilities just to make sure everything is up and running correctly. In conclusion, we need to have this program because if we can successfully implement it into our community, we can help save lives one patient at a time. Thank you.